Hi, it's Ashley from Complete Health Benefit Solutions, and this video is going to be about Medicare Supplement plans and how exactly you go about choosing the right Medicare Supplement plan. It is a very important decision. People simply make their decision based off what everybody that they know is enrolled in and what they have always heard to be the best Medicare Supplement plan. Right now, probably more so than any other time recently, is probably the worst time to enroll in a Medicare Supplement plan based off either what you've always heard or what other people are enrolled in. And we'll talk a little bit about this more later, but there are really big changes coming to Medicare Supplement plans that go into effect January 1st of 2020. But we've been seeing those changes have an impact to Medicare Supplement plans for the last couple of years. So again, biggest piece of advice is make sure that you are enrolling in a supplement plan based on really the logical factors that apply to your specific situation. Choosing a supplement plan is just not a choice that you want to make based on anything other than your individual circumstances. So let's talk a little bit about the different kind of times that people find themselves choosing a Medicare Supplement policy. So the most common is part of the decision-making process when people are entering Medicare for the first time. So you enroll in A and B, or you've been enrolled in A and B, and you're then making the decision between Advantage, Supplement, maybe a retiree plan. 60% of people in the United States have a Medicare Supplement plan. Right now, I believe that the national average for enrollment in Medicare Advantage plans is around 36%. The insurance companies are definitely working hard to raise that number, but most people still go with Medicare Supplement plans. And to be honest, for most people, it is the best decision. It gives you the most flexibility when it comes to keeping your plan, even if you move across the country, having benefits from coast to coast, and the flexibility that a lot of people want when it comes to choosing the physicians and facilities that will treat them if they get sick or face a catastrophic illness down the road. Don't get me wrong, there's absolutely other situations where Medicare Advantage is the right choice for people, but we're gonna stay on track with the Medicare Supplement plans. So when it comes to choosing when you're first entering Medicare, it's kind of this golden opportunity that is called your Medigap open enrollment period. So again, that's going to be when you're first entering Medicare and the 6 months following your Part B, as in boy, effective date. So you can pick a Medicare Supplement plan to start the same day that your Medicare starts, or in the 6 months following your Part B effective date, and you're still within your open enrollment period at that time. The reason I referred to that as a kind of golden opportunity, or really important window to make sure that you catch, is because during that time, you do not have to go through medical underwriting to pick the Medicare Supplement plan that you want, the company that you want, and simply enroll. You enroll in the plan, you don't answer any medical questions or provide any medical history. They simply accept you and you pay your premium. As long as you continue to pay your premium going forward, you get to keep that plan. Under no circumstances, as long as you're paying your premium, can that insurance company terminate your coverage or even increase the premium that you pay based on your health or anything else like that. We'll dig into a little bit more about how premiums are determined in just a bit, but I did want to make sure that you understood that, you know, that six months within your Part B becomes effective, kind of the golden opportunity that you have there. Now, caveat is if you start Medicare under the age of 65, really the only way to be awarded Medicare before age 65 is either end-stage renal disease, or if you are awarded Social Security or railroad disability benefits. So 25 months after you were awarded Social Security disability, you then start Medicare. You're automatically enrolled in A and B. So at that point, you might, depending on what state you live in, have an opportunity to enroll in a Medicare Supplement plan. Now, that is not going to be referred to as open enrollment. You might hear that, but that is not accurate. You actually have what is called a guaranteed issue right. If your state has that as a law on the books, but if so, you would be able to enroll in a Medicare Supplement plan. Now, I am not going to get into all the ifs, ors, buts, because Medicare Supplement guaranteed issue periods for people under the age of 65 vary dramatically state to state. And then other things vary. You may only have one or two plans to choose from. You may have all of the plans to choose from. You may pay, you know, a rate that is similar to what you would pay when you turn 65. You may pay a rate that is 2 or 3 times that to join a Medicare Supplement plan under the age of 65. Don't try to guess at that. Let somebody who is well versed in it talk you through that and help you through that decision-making process. But the reason I even went off on that tangent is because if you have been on Medicare, I don't care how long, but you have been on Medicare under age 65 due to disability, and maybe you're enrolled in a retiree plan, maybe you're enrolled in a Medicare Advantage plan, maybe you're enrolled in another Medicare Supplement plan. When you turn 65, you still get that Medigap open enrollment period. So that is really key. That is something you do not want to miss, because that is going to be your one opportunity to change supplement plans, leave your retiree plan for a supplement plan that may save you a lot of money, or drop your Medicare Advantage plan and choose a supplement plan without having to go through medical underwriting. So just like anybody else turning 65 but entering Medicare for the first time, you get to pick the company, the plan, and simply enroll in it. And they have to accept you. And as long as you pay that premium, you will continue to be covered for the rest of your life. So turning 65 and new to Medicare, already on Medicare but turning 65, are your open enrollment periods. And then there are various, and again, I'm not going to go into all of these in detail. I will make sure you have the information available via email, but there are various what's referred to as guaranteed issue circumstances or rules that may afford you a opportunity to enroll in a Medicare Supplement plan without going through medical underwriting. Again, it gets very, very specific. The one that I want to touch on, because a lot of people find themselves in this situation, and when they find that they're not in the situation they want to be in, they think it's too late and they think that there's nothing they can do about it. So please catch this one closely. There's something called a trial right when you enroll in a Medicare Advantage plan. Now, there's 2 ways that this trial right can apply. So it is if you're enrolled in a supplement plan, and you drop that plan and leave original Medicare to enroll in an Advantage plan, okay? If you take those steps and any point during the first 12 months regret that decision, you can exercise your 12-month trial right. If when you started Medicare, so let's say you just turned 65, enrolled in Medicare, you really liked the idea of not paying any additional premiums outside of the $135.50 that you have to pay for Part B, so you enrolled in a Medicare Advantage plan. Let's say a couple months down the road, you get into it and find out that it is a HMO that offers you no choice in physicians. Well, you'll have a small choice, but the choices that you want are not available, and maybe the plan isn't covering one of your drugs, or maybe you just learned something about the plan that you don't like. As long as that's within the first 12 months, you will have the guaranteed issue right to exercise and enroll in a Medicare Supplement plan without Medicare underwriting. But after you have exhausted that, or after you've exhausted your open enrollment, whatever case it may be that you enroll in a supplement plan for the first time, you're going to have to go through medical underwriting in the future to change your Medicare Supplement plan. And I guess the reason that I keep stressing that, and you're probably sick of hearing me say medical underwriting at this point, and I promise I'll back off of it, but it's so important that you get your initial choice right, because like I said, in most circumstances, when you are first entering Medicare, that's going to be the one time that you get to enroll, and you're never going to have that opportunity again. So with that, there's several things that you want to make sure you're factoring into your decision when you're making that first Medicare Supplement choice, okay? At the end of the day, all of this comes down to a numbers game. You've probably heard me say that before, and it's because you're retired now. You're not going to be getting raises. There's not really going to be increases in your income. Your income's going to pretty much be fixed. You could be looking at another 20 or 30 years of life. We all know that the cost of living and groceries and gas doesn't go down. So you want to control your healthcare costs absolutely as much as you can. And one of the ways to do that is making sure that you're picking the right supplement plan and not paying too much for it. First, I want to talk about the different supplement plans that are available. Supplement plans are kind of like an alphabet soup. It's lettered plans. So you've got A through N. So we're going to take a look at those different supplement plans, what they cover, and kind of do an overview of what the difference between those plans are. Then we're going to have a pretty detailed discussion about how you go about picking the right insurance company to enroll with. One of the biggest mistakes that people make is enrolling with the insurance company that they're familiar with. So maybe that means that it's the insurance company that you had for the last 20 years because that's who your employer had. If you're not looking at all your options and considering some of the very important factors, you very likely will end up paying far too much for your supplement plan. So we'll talk about the different things that you look at when you're looking at the insurance companies as well. And then I'll show you guys how I go about picking the insurance company to recommend. So the first thing that we will talk about is the Medicare Supplement plans. Like I said, there's several. It's a big alphabet soup, A through N. So I'm going to show you guys the Medicare Supplement plan grid, that really puts all of these side by side and lets you kind of compare the differences between the plans. So this is one of 2 pages that shows you the supplement plan grid, so don't think that this is all of it. But to get started, here you see plans A, B, C, D, F with an asterisk because there's also a plan high deductible F, G, K, L, M, N. Now, again, we're going to get into this in a little bit more detail in a moment, but those big changes that I talked about coming in January of 2020 with Medicare Supplement plans, that directly impacts Plan C and Plan F. So we'll talk more about that in just a few moments. But here you can see all of the supplement plans except for K and L are going to cover 100% of the basic benefits. So let's talk about for 1 minute what those basic benefits are. The basic benefits for Part A that all of the supplement plans cover at 100%, except for supplement plans K and L, are the Part A coinsurance when you are hospitalized, plus an additional 365 days after the Medicare benefits end. So it is very important to understand that hospital days with original Medicare are limited. You can end up incurring extremely high costs on your inpatient hospital services with just original Medicare or a plan that does not cover additional hospital days beyond what original Medicare covers. So that's huge. Those additional days are very important. Also included in the basic benefit for Part A is the first 3 pints of blood each year. So with original Medicare, they actually don't cover those first 3 pints of blood each year. So you can actually incur some costs there. All of the Medicare supplement plans, except for K and L, are going to cover that for you. Plus, your coinsurance for hospice is going to be covered. Now, if you think back to when we talked about Medicare Part A benefits, there wasn't a coinsurance as in like an 80-20 percentage like you see on Part B. Instead, it's kind of like a per day copay. Just so you know, Medicare refers to that as a coinsurance. So those really are the 3 things that are included within the basic benefit for Part A. For Part B, the basic benefit includes the Part B coinsurance, which is pretty flat across the board of 20%. Once you've made that Part B deductible each year, currently it's $185, the Part B benefit goes to 80-20. So Medicare pays 80%, and you pay 20%. Most or all of these supplement plans will cover the Part B coinsurance, but what varies between the plans is when they start covering it and whether or not they apply a copay that you do have to pay while they cover the coinsurance amount. You can see here on the grid, plans A through G are all absolutely identical when it comes to covering the basic benefits, including the Part B coinsurance at 100%. M is the same way. That was M as in Mary. Now, K and L get a little bit crazy. Again, we're not going to dig into that in detail because I have never come across a situation where it makes sense to enroll in K or L. But then you have N there on the end, and it covers, as you can see, all of the basic benefits, including the Part B coinsurance at 100%. So that first excerpt right there is exactly the same as the rest. But what makes Plan N stand out is that You do pay a $20 copay for each outpatient physician's office visit that you have. And you also have a $50 copay for emergency room services. Now that copay is waived if you are admitted to the hospital, but if you go to the emergency room and you're not admitted, you're paying a $50 copay. Now, Plan N, we're gonna talk about a little bit more when we actually look at the pricing on the supplement plans, because Plan N is absolutely what insurance companies are going to push starting now. One of the insurance companies actually had an entire training webinar just today to train agents on why they should advocate or push to sell and more. So please keep that in mind and be very kind of cautious of that. If you come across somebody who's really pushing you to enroll in Plan N and you feel like Plan G is a better fit for you. And we'll talk through kind of how to make that decision. But there's definitely incentive for agents to enroll in Plan N. At the same time, if there is a big enough premium difference between G and N, and you don't foresee having to go to the doctor's office more than maybe once or twice per month or even less, there's absolutely plenty of situations where Plan N may make perfect sense. So again, when we look at how to kind of work out all the numbers, I'll walk you through that, but just make sure that you aren't being convinced of something that might not be the case. So let's take a look at this second page here that will really allow us to go into the benefits that set the plans apart. So as you can see, I put, and this was me, this is not something that an insurance company or Medicare would tell you, but this is drawing off my experience. Rarely is A, B, C, or D something that you would strongly consider. Same with KLM. And the reason for that is when we look at what is covered and what's not, and then we look at the premiums, those other plans just don't make sense. So Part A, or Plan A, for example, it only covers your co-insurances on original Medicare. There's a lot of other things that it doesn't cover, as you can see, that these other supplement plans do cover. C is like Plan F, is impacted by MACRA. That is the Medicare Access and Chip Reauthorization Act, which was enacted in 2015. And one of the big impacts to Medicare that MACRA is going to have is that starting in January of 2020, anybody who is not previously enrolled in Medicare or a Medicare Supplement plan cannot enroll in Plan C or Plan F, okay? So if you're already on Medicare, or if your Medicare starts December 31st, 2019 or before that, you're not so much impacted. You could still enroll in Plan C and F if you want. We'll talk a little bit later when we talk about premiums about why that may not be the best idea. So D and G, so you can see D is right beside C, G is right beside F. D was put in place to replace Plan C. G was put in place to replace Plan F for people who joined Medicare January 1st, 2020 and after, who do not have C and D available to them as an option. Now, if we look at Plan C and Plan F, Other than the Part B excess charges on the second to last line, you can see that they cover everything exactly the same. You can also see that they are the only two plans that cover the Part B deductible, and that is exactly what led them to their demise. So the part of the MACRA Act that is requiring that they essentially do away with plans C and F is that the fact that there's no member cost share. The powers that be that wrote and then put into place MACRA felt like when people don't have skin in the game, meaning they don't pay for any of their medical services, that they're a lot more likely to abuse the healthcare system or overutilize the healthcare system and essentially cost Medicare more money. So because of that, the plans that don't have member cost share are, like I said, essentially going away, even though you could still enroll in them as long as your Medicare was effective before January of 2020. But D and G were created to essentially replace them. Right now, if you think back to when I was talking about guaranteed issue, if you're joining Medicare due to disability and not 65 yet, and they have these guaranteed issue plans that you can enroll in, although all Medicare Supplement plans may not be available to you. Right now, the most common guaranteed issue plans are plans C and F. Starting in January, D and G are going to become the guaranteed issue plans. Now, the reason that is important to know and understand is because that can, in theory, impact the premiums. Basically, because people who usually are using a guaranteed issue period are going to be a little bit more high cost. So for most people, and I know this isn't necessarily the case for most people who are on disability from the railroad, but most people who are awarded Social Security disability are going to have high medical expenses. And so if you consider that in most states, the only supplement plan that they have to choose from is right now C and F. After January, it'll be G and D. You can bet that those plans are going to have a little bit higher amount of high cost people in it, which can impact the claims. So that's why that is important to know. So moving along, as you can see here, F, G, and N are really the plans that most people look at when they are considering Medicare Supplement coverage. Now, with F no longer being available to the younger, presumably healthier population that is entering Medicare at age 65, a lot of people are applying the theory, and it absolutely makes sense, that because the people who are enrolled and able to enroll in Plan F are going to age. They're going to get older and presumably, almost inevitably, probably either sicker or at some point more high cost. Then a lot of people expect the premiums to become very unstable and take higher jumps over time on Plan F simply because you don't have the younger population joining the risk pool of Plan F to help offset the cost of the older, more expensive people with the premiums. So a lot of people are making that prediction. It's a pretty solid prediction to make. They're not just betting on it. Regular insurance actuary practices, the math probably works out that way. The insurance companies may get creative and come up with a solution. They may also just get rid of Plan F. So that is to be determined. We will have to see, but it's an important thing to know. So in most cases, I'm not going to recommend that somebody enroll in Plan F, because if they get stuck in Plan F and everybody who's healthy leaves because they can save money on a different plan, and they're stuck in a very small, sick, aging risk pool, their premiums could end up being astronomical. So that's why, for the most part, I steer towards G instead of F if you're really wanting the most comprehensive supplement coverage. Here's why, hands down, it's the most comprehensive. As you can see here, F and G are the only ones that cover excess charges. I'm going to explain that in the email, just because I don't want to talk to you about it for 5 minutes and make you listen to that for 5 minutes. There's a lot of argument recently that excess charges is not applicable and doesn't happen 99% of the time. I find that a little hard to believe. I've heard it said a lot. I've never seen the numbers, or I've never seen the backup for that claim. I also feel that it's possible that people are discounting the importance of coverage for excess charges because of the push for Plan N. But go check out what that means. It's basically additional costs that you can take on if the doctor does not accept Medicare assignment. So with the coverage of excess charges, with Plan G, the absolute maximum that you could pay in a year in medical bills, remember, drugs are their own animal, so this doesn't include drug care costs, but is $185. It's the Part B annual deductible. So $185 is the most you're going to pay in medical bills as long as all of your services are covered by Medicare. So I've talked to a lot of people recently who are getting $6,000 cataract surgeries. If you're enrolled in Medicare A and B with a supplement Plan G, you're not paying $6,000. The most you can pay in 1 year in medical bills is $185. Once you've hit that, you're done. So as you can see, G and F are the only ones that offer that. There is an asterisk by F, that is to denote high deductible Plan F, which will have the same impact from MACRA that Plan F has. They will come out with a high deductible Plan G on January 1st. And what that is essentially the benefits are exactly the same as F or G. The premium is about 50%, if not less than 50% of a regular Plan F or G. But the reason that premium is so much lower is because for 2019, the deductible is $2,300. So the supplement plan is going to cover all of these same things, but only after you have met your $2,300 deductible. So with high deductible Plan F or G, Medicare pays premium. Your supplement plan always, doesn't matter which one it is, pays secondary to Medicare. And if you have the high deductible plan, it is not going to start issuing payments until you've met out of your pocket that 20%, until you've met that $2,300 deductible. Now I'll tell you, it's going to take some pretty significant expensive services to get anywhere near that. Most people's Medicare utilization is with Part B. And remember, after you've paid the $185 deductible, Medicare pays 80%, and Medicare is paying your claims first. So the piece that is going to the supplement plan is that 20%. So if you're not having multiple outpatient surgeries, chemo, radiation, dialysis, or multiple inpatient hospitalizations, you're not getting anywhere near that $2,300. Again, it's something that you have to shake out in a numbers game. So we will take a look at those examples. So next we're going to talk about how Medicare plans are priced and move through that information as quickly as possible. I know this is taking quite some time, but there's so much important information for you to hear. But we'll go through the numbers. I'll show you how to check your own prices, and you're gonna know a lot more when we're done. So hang in there with me. Okay, so we have talked about the different Medicare Supplement plans, although there are several lettered A through N. Really the most popular plans, and for good reason, are F, G, N, and then high deductible F, which will soon be high deductible G. So the next important piece of picking your Medicare Supplement plan is which company is going to administer those benefits. So the supplement plans are what is called standardized uniform. The only exception to the Medicare Supplement plans being standardized and exactly the same benefits regardless of where you're located or what company you buy your plan from is if you are a resident of one of 3 states that really has gone outside of the mold and created their own supplement plans. So those states are Minnesota, Wisconsin, and Massachusetts. If you do not reside in one of those 3 states, like I said, a Plan G in one state is the same as Plan G in another. Where you can see a very significant price difference, though, that doesn't have anything to do with the insurance company necessarily, is there is a handful of states that allow what is called continuous open enrollment. So remember all that talking about underwriting that I did at the beginning. If you live in New York, New Jersey, or Connecticut, that does not apply. So those states have mandates that allow you to change plans pretty much freely. People in those states pay a significant amount more for their supplement plan, basically because the insurance companies don't have any underwriting control of the medical expenses that they're taking onto the plan. So just keep that in mind. The state of Washington isn't considered continuous open enrollment. I know that there are several retirees in the state of Washington. The state of Washington pretty much allows you to change plans without underwriting as well. And those plans run, $80 to $120 per month more than what they cost in other areas of the country. So let's dig in just a little bit more into picking the right company, because that really does make a difference. I want to show you guys the system that those of us in the industry use. Not everybody uses it quite to the level that I'm going to show you. I won't spend too terribly much time on it because really it's my job. But I do like you to see the level of analysis and thought that's put into it to make sure that you're enrolling in a plan that is gonna not only fit your needs for healthcare, but also fit your needs financially now and in the future. Those are the 2 things you're really weighing when you're making this decision. So let's take a look. This system is available and used industry-wide. It is called CSG. It's an actuarial tool. There are 4 pieces of information that Medicare Supplement plan quotes are derived from. So everybody is provided a cost for their plan, their monthly premium, based off of these same 4 items. So it's very simply your gender, age, zip code of your home residence, and whether or not you have used tobacco in the last 12 months. So your health history, your current health status, none of that is factored into your supplement plan premium. So looking here, I just ran this in my local zip code, 66502, for a 65-year-old female who does not use tobacco. And you can see here, I pulled 5 different examples to kind of walk you through the different things that I look at. So all of these are a Plan G. And then you can really see up there at the top how the cost varies widely from $102.66 all the way up to $334.17. But that is not the only thing we're looking at. We're not just looking for the lowest premium. There were some lower premium plans when I ran the quote that, were available. But I didn't include them because they didn't meet the standards that I apply when looking at these. So to give you just an idea of what I'm looking at, I look at a couple different things. So first of all, this household discount, HH discount, different companies give varying different amounts of the household discount. You can see it here at 5, 7, and 12%. I will tell you, every company has their own rule on how you qualify for the household discount. Some of them are as simple as if there is an adult age 18 or older who lives in the home, you get the household discount. Some of them require you live with a spouse. Others are more of what we call a multi-policy discount, which basically means you and another adult also on Medicare in the same household both have to have supplement plans issued with that same company. So that's, is not going to apply unless, we have a married couple or something like that. That is going to qualify for the household discount. But it is very common that people qualify without that. So, I'm looking at whether or not a household discount can be applied because that can change the rate dramatically. So you can see here in this middle one, the monthly rate is $127, but with that 12% household discount applied, and this is one of the easiest ones to qualify for, it's the biggest discount and one of the easiest to qualify for, it drops it to under $112. So that is a pretty significant discount. These other 3 are more difficult discounts to qualify for, but even with the others not applying the discount, this one with the strong discount doesn't even make it in the top 3. So then we're looking at these other companies, and one of the important pieces of information that I look for at very first is their credit rating. So I'm only going to look at companies who have an A rating or higher, because that is going to be our best indicator of that company's financial stability. So after I have looked at the financial stability of a company and make sure that I'm only considering A-rated companies, I'm going to next then look at the market analysis. So that's going to be this information in the upper portion. And what I'm looking at here is, loosely without, an extreme amount of weight, I'm looking at their market saturation, which is this percentage number. So basically, of all the Medicare supplement plans in the country, what percent of membership does this company have? So the first one has 1.34% of the Medicare supplement members on their plan. It's actually over 200,000 people, and they're collecting a very high amount of premiums at over 200,000 people. But then if you go all the way over to the other extreme, we have this company who has a whole 31% of the Medicare Supplement members in the country enrolled in their plan. Now, I will tell you that the reason that this premium is so high in this particular quote is because this insurance company is not competitive at all in the Midwest, but they are usually hands down the most competitive, best priced plan on either coast. So I don't want that to be confusing to you. But what I'm really looking at here is their loss ratio. So we really would not want to enroll you in a plan that has a loss ratio of above 85%. What I would say the standard is 75 to 80%, which means they're paying out, 75 to 80% of the money that they bring in premiums is getting paid out. What most stable insurance companies are going to do is set aside a reserve to pay claims in a bad year. They're going to reinvest that money so that money makes money, so they're able to remain solvent if something crazy were to happen. Which, in case you're wondering why that is important to you, it's extremely important to you because all of those things are going to hopefully keep the premiums from increasing at a completely unreasonable rate. Now, I don't want you to make your head spin looking at all those numbers and trying to make sense of them. Like I mentioned before, that is absolutely my job. But I did want you to see kind of what we're looking at when we're looking for a good plan. Just so you know, that system that I showed you, now it is not going to look the same, but I pay extra every month for a customer version to be available on my website. So let me pull this up here. You can navigate to my website. There's no www because my site is secure. It's just https:// and then mychbs.com. You can see it here. And on the menu at the top, there's a drop down that says DIY, do it yourself quotes, and Medicare Supplement DIY quote. So there you can enter in the same pieces of information that I told you that I would run a supplement plan quote on, which is zip code, gender, age, and tobacco use. And you can see the supplement plan. You can see the supplement plan costs in your area. Now, what this is not going to factor in is household discounts. So those may or may not be available to you. It is also not meant to be ran by somebody who is on Medicare under age 65 years old. That's something that you need to work directly with myself or somebody else that you trust. Just that way that the state mandates can be factored in correctly. It will default to pulling plan G. If you're wanting to see F or N or any of the other plans rates, you can just change the plan there at the top using that drop down, tell it to run the quote again, and really get a good idea for yourself of what you could expect for the cost of supplement plans. May or may not get the bonus of a household discount. Know that if you do use tobacco, your rates will be slightly higher than what is shown if you choose non-tobacco. So you definitely want to make sure that you reflect that correctly. If you have any questions, it will give you the opportunity to send that quote to me. That way I can see what you're seeing, ask any questions that you might have, and I'm happy to talk through it with you, provide outlines of coverage or anything like that from that particular insurance company so you can have some other insight. So it honestly really amazes me that not only agents, but even some insurance companies out there are still heavily promoting the enrollment of people into Plan F. Plan F is a great plan. My concerns with Plan F have nothing to do with the plan or the company. My concerns are with how that premium is going to grow in the future. I want to show you a really good illustration of why the difference in the premium now, even though that gap may be fairly small and not seem like a whole bunch now, that gap is going to grow over time. It is very important that within reason, you start with your premium as low as possible. Now, you don't want to sacrifice the quality of the insurance company you're enrolling with, and you don't want to sacrifice benefits. Looking at this illustration, you can see that the difference between Plan F and Plan G at age 65 is only $30 a month. Pretty easy to just enroll in that plan when, you know, everybody you know is enrolled in Plan F. Everybody constantly tells you that Plan F is the best. It's a $30 difference to enroll in Plan F. But that $31 is actually almost $400 a year. But more importantly, look at how that gap grows in 5 years from 31 to 38. And in another 5 years, all the way over $47. So that extra $375 a year that you're paying, just 10 years later, is $570 a year more for a plan that has the exact same benefits except for a $185 deductible. So it is that piece that I really like people to consider, because supplement plan premiums always increase on a percentage basis. So imagine that $50 premium difference when the premiums are being increased across the board by 5%. 5% of $175 is a lot more than 5% of $125. And that's going to compound every year. So your premium will start higher, it will grow faster, and it just doesn't make long-term financial sense, especially if you end up unable to change supplement plans because of an illness or a diagnosis. Now, many of the carriers have different kind of programs that they make available to their members. There are also several states that prohibit an insurance agent or broker from even discussing what those programs are during the sales process. So don't ever be surprised if when you get your member packet with your ID card that there's a whole bunch of information in there about silver sneakers or a eyeglasses discount or prescription discount program, various different things that your agent didn't mention anything to you about. In a lot of places they can't. So beyond that, you do not need to consider many of the things that you're used to considering. Number one being network. There is no network that you need to worry about. If you enroll in a supplement plan with, say, Blue Cross Blue Shield, because that's what you always had, when you call your doctor to make your first appointment once you're on Medicare, you don't have to say, you know, I'm on Medicare now, do you accept Blue Cross Blue Shield? That's going to be extremely confusing, and you're probably going to get a wrong answer, because when they hear Medicare, and an insurance company, doctor's offices are automatically going to think Medicare Advantage. Instead, you just need to remember that Medicare is primary. So really all you're asking your doctors is if they will accept you as a Medicare patient. They will file the claim to Medicare. You'll give them your red, white, and blue Medicare card. You can give them your Medicare Supplement plan card, but that's essentially just to show them that you're not gonna have any additional costs, depending on the plan that you're in, because your supplement plan is going to pick up what Medicare Part A and B does not. And when you're enrolled in a supplement plan, the doctor files the claim to Medicare. As soon as Medicare files that claim, they electronically pass that on to your supplement plan. They process the claim and apply your benefits and issue their payment to your provider. So it's not extra work for you. It's not extra work for your provider. You don't have to worry about your doctor accepting this insurance company or the other. Again, in the most brief recap, the most important things when it comes to selecting the company are not all of the things that you're used to thinking about when you think about an insurance company. You really want to look at the things that are going to impact the cost that you have to pay for that supplement plan. So we're getting really, really close to the end. I thank you guys for hanging in there with me, but we're gonna talk lastly about probably what you all are watching this video for anyways, which is cost. The cost of the supplement plans. So what I want to kind of just talk through real quick is Plan F. So we already talked about how MACRA is going to affect Plan F and potentially have negative impacts on the premiums. We've been seeing those premium increases increase at a rate that is just uncomfortable. You want to see your supplement plan premiums take baby steps up. We never want to see big hits. One thing to kind of keep in mind after you enroll is if you ever have a jump more than 7%, you need to automatically reach out and let whoever you have worked with to enroll in that plan know and help you determine if you are insurable and can be approved through an underwriting process and potentially change your plan. There's no reason with Medicare Supplement to pay more than you have to when every company offers exactly the same benefits. And essentially at the end of the day, that's kind of how I see Plan F and Plan G. The only difference between the benefits in F and G is the $185 Part B deductible. Right now, in the most stable markets, the premium difference between F and G is anywhere from $350 to $450 a year. And if we've talked on the phone, you have heard me say there is no reason to pay $400 a year more to avoid paying $185. That just doesn't make number sense at the end of the day. And why Plan G, which has essentially the same benefits except for that Part B deductible, but a significantly lower premium, usually makes sense at the end of the day. Now, we know that the insurance companies, and this is hot off the press, I'm not sure that a lot of other agents are even aware of this yet, but we're definitely going to see Plan N premiums coming down. The insurance companies want to see people go into Plan N. That's never something that drives my decision. Like I have explained, it all comes down to a numbers game. Right now, Plan N, the difference between the premium between Plan N and Plan G is not enough of a gap, and that gap would be with Plan N being cheaper for you to take on the copays. So until we start seeing a shift in the Plan N premiums, I would still say that for most people, Plan G is a really kind of safe way to go. The premiums are relatively low and you have very fixed medical costs that are low. And that's something that's very important as you're going into retirement. I hope that some of you are still with me and not asleep, or your computer fell asleep, because I know it's a lot of information and it's a little bit dry, but important, right? Because it's a huge decision for you. The good news is I can usually go through that entire process in a matter of a couple minutes, because I do it day in and day out, helping people enroll in their supplement plans. So I hope that this was a good overview for you, and I hope that you were able to capture some insight that you didn't have before about picking your supplement plan. If you have any questions, need any help finding supplement plans, want to know if a household discount is going to apply to you, or flat out just don't want to have to try to recreate all that and would like me to do it for you, I would absolutely be happy to. You can reach me at 785-370-3017. At the very end of this video, I'll make sure that both the website where you can schedule an appointment and my email address are listed. Again, thank you for hanging in there and listening to all of this information.